Have you ever wondered why you struggle eating protein and how to get more of it? Hi, my name's Luke and I'm one of the dietitians here at Active Health Clinic, and today I want to talk about one of my favorite tools in my improving nutrition toolbox, which is protein supplementation. Now, over the last few years, one of the most common conversations I've had with patients and with other people who see invisible illness patients is that protein, and particularly meat, is one of the hardest things for people with these invisible illnesses to consume. There are multiple reasons why this might be. Sometimes it's texture challenges, sometimes it's the gut symptoms that can arise from protein just being that little bit more difficult to digest and actually move through the gut. And sometimes it's issues with dairy, which is a great source of vegetarian protein for those who don't eat meat. And sometimes when people have chosen not to eat meat and dairy for certain ethical reasons or religious reasons, that can make protein intake really hard to get in. And all of those reasons are fair enough, but protein intake is super important. And this is because it helps with muscle synthesis and muscle mass retention. And these are two things that are really necessary in helping someone with an invisible illness to reduce deconditioning and maintain their muscle mass through periods of flare where they may not be as active as they want to be. And we need to try and make sure that we can keep as much of this muscle as possible through this protein intake so that when we are able to get up about and move again, when we are able to work on that deconditioning somewhat, that we'll actually have a firmer foundation to do that with. So if we're struggling to get enough protein in our diet, for any of the reasons above or others, one of the reasons, or one of the things that we can use rather to help with that protein intake is protein supplementation. There are three main types of protein supplements. There's whey protein, which is a very pure form of protein that comes from dairy. There is a mixed dairy protein blend, which will generally be something whey and casein based. And then there are vegan or non-dairy protein sources. This can come from many types of plant matter, whether it be pea, rice, soy, hemp, egg, fava bean, and mixtures of those. And there's also collagen protein, which has some interesting research on it in the setting of EDS and HSDs. And I filmed another video on that that you can go and find. But any of those types of protein will be good and will work well. It really just depends on personal preference and what you need from an intolerance or allergy standpoint as well. So be mindful of that. For me, my tip is to find the protein supplement with the least amount of fillers as absolutely possible. You don't need them in a protein supplement. And if you have a sensitive gut or react to some foods or chemicals, it is likely that they won't exactly agree with you. So let me know if you have a favorite protein powder below. I certainly do. And I'm happy to share that with you if enough people ask. But I'd be interested to hear your thoughts. So comment that below, and until I speak to you again, take care and happy eating.